My name is Erin Russell and I'm a veterinary technician at the Thames Valley Animal Clinic. Today I'll be talking about the prevention of zoonotic diseases in clinics. Zoonotic diseases are a big health concern to us and our clients. Zoonosis can be caused by parasites, bacteria, or viruses. It is important that we take precautions to prevent the spread of these diseases. In this presentation, we will discuss who is most at risk and the precautions we can take. So who is most at risk of contacting zoonotic diseases? Children, pregnant women, elderly, immunocompromised people, and us animal care workers are at risk. It is important to educate our clients to prevent them becoming infected. How can we prevent the spread of zoonotic diseases? Any infected animals should be kept in isolation to prevent spreading the disease. Anything that comes in contact with the animal should be cleaned, and of course the entire clinic should be cleaned regularly. Also, we can protect ourselves by having proper hygiene and wearing personal protective clothing. The isolation room should be in a low traffic area to avoid others coming in contact with the infected animal. One person should be assigned to care for the isolated animal. The person caring for the animal should wear personal protective clothing, which we will discuss later on. Cleaning is the #1 way to prevent the spread of diseases. All surfaces, like tables and floors, should be scrubbed with diluted detergent. It should then be scrubbed with diluted bleach. Disposable equipment should be disposed of properly, and non-disposable equipment needs to be disinfected. Shoes should then be disinfected before entering and leaving the isolation area. Proper hygiene is important to protect yourself and others. You should wash your hands before and after handling a patient. Hair should be pulled back and clean scrubs should be worn. Fingernails should be kept short because long nails can be a home to bacteria. Jewelry should not be worn because it cannot be sanitized properly. Finally, personal protective clothing should be worn while dealing with infected patients. This includes boots, lab coat, gloves, and a face mask. Personal protective clothing should be removed before leaving the isolation room. Your clothing should be changed before going home so the disease is not carried home. Personal protective clothing should be washed separately from your own clothing. Preventing the spread of zoonotic diseases is a simple task that should be taken seriously. It may take a bit more of your time, but it will be very beneficial to the practice in the end. Thank you for listening to my presentation.